Hello, students. It's Sage Fernetovich here, and I'm here to talk to you about antimicrobial drugs. This is for my microbiology class at Greenfield Community College. Welcome. Antimicrobial drugs include um, antibacterial drugs, antiviral drugs, antifungal drugs, and antiparasitic drugs. So these treat what they refer to bacteria, viruses, fungi, and parasites. We're not going to go too far into um, most of these. I'm going to focus mainly on the antibacterial drugs because that's what we will have a lab on coming up on March 26th after break. That's 2026 for people who are seeing this at a later date. But we're going to be looking at the mode of action and some examples of antibacterial drugs. These drugs can be broad spectrum or narrow spectrum, depending on what they're targeting. Broad spectrum drugs are effective against both gram-positive and gram-negative bacteria. So they have a broad reach, and the narrow spectrum drugs have a limited range of bacteria that they can target. We usually prefer the narrow spectrum drugs, especially at first in treating a disease. They are less likely to cause disruptions in our gut microbiota, and they are more specific, hopefully targeting the infectious agent. These antimicrobial drugs, when they're treating bacteria, can be bacteriostatic, in which they prevent bacteria from growing. They kind of make that bacteria stable and not reproductive. Or they can be bactericidal, which will kill the bacteria directly. And they could do this by targeting cell wall or cell membranes or even nucleic acid synthesis inside the cell. So a drug's bactericidal or bacteriostatic properties can change, and that is the drug's properties will be different based on what pathogen is targeting, the dose of the drug, the regimen of that antimicrobial agent, how long is it being prescribed for, the way of administration, and the pathogen. So antimicrobial drugs can be chemically modified to enhance desirable properties. Many of our antimicrobial compounds are derived from plants or are plant extracts themselves. We can synthesize these drugs so that we can make them more easily in a lab and we can manufacture them, or we can chemically modify existing natural compounds to be more targeted to our bacterial infections. These can be first-gen drugs, second-gen drugs. First-gen result from a first round of chemical modification, second-gen from a second round. So this part of the book, I did include here some, after reading this section, you should be able to's. So you can see what some of the targets are for learning. There's a lot of information in this part of the book, in this chapter. I don't expect you to learn all the different types of drugs. I do want you to know the penicillins and look at the drugs that we are going to be working with in lab. And those are ones that you should be aware of. We group these antimicrobial drugs and antibacterial drugs based on their targets. So here I'm going to be focusing on antibacterial specifically. And these drugs can target, as I said, the cell wall. They can target the cell membrane, DNA, ribosomes, proteins, enzymes. And we group the antibiotics based on what they target. Table 15.1 is a pretty extensive table in the textbook. However, it's got some interesting information in it and some names of drugs that you might hear in your offices that you work, or in everyday life. We've got things like bacitracin, a pretty common topical antibiotic that disrupts cell wall synthesis of certain bacteria. We have our penicillins here, which are in the drug family penicillin. And we have others as well. The table goes on, and you can see sulfa drugs, tetracyclines. Important to recognize that these different types of drugs target different parts of the bacteria. Many antimicrobial drugs disrupt that cell wall production, and they can do this in a couple different ways. Normally, transpeptidase enzymes build protein crosslinks, but drugs in the penicillin class specifically block that transpeptidase enzymes and prevent them from making those crosslinks, so the cell wall can't form. And that's basically how penicillins work. They get in the way of producing a cell wall for a bacteria cell. Bacteria can't function anymore, and they will succumb. Similarly, beta-lactam antimicrobials target bacteria cell walls. These block cell wall construction by containing a four-sided beta-lactam ring. And these bind to the transpeptidase enzymes, blocks the linkages. So right up here, we're seeing that take place. So these are the penicillins, like in that illustration from the textbook. Cephalosporins, carbapenems, and monobactams also act in this way. Many bacteria make enzymes that inactivate beta-lactam drugs called beta-lactamases. So this is a type of resistance that we do see to this type of antibacterial drug. So note about the penicillin, since this is one that's often talked about. Penicillins were some of the first antibacterial drugs to be manufactured, and one of the first to be officially recognized in our Western medicine. This is a family of natural and semi-synthetic compounds now, widely prescribed. They're safe, they're have minimal side effects, and the main concerns are patient allergies and resistant strains of bacteria. Interestingly, there have been many misdiagnoses of allergies to penicillin drugs. It was an issue in the 80s and 90s. Doctors often told their patients that they were allergic to penicillin, but many actually aren't. I have a Freakonomics podcast posted on Moodle about this. So I encourage you to check it out, especially if you've been told you're allergic to penicillin. You actually might not be. Okay. Antiviral drugs are classified into groups according to the viral activity they target. So looking at antivirals for just a moment, these will attach, penetrate, uncoat. They can get in the way of viral replication and assembly and get in the way of viral release. So there are incidence of people suffering from antibiotic resistant infections. And when we're talking about antibiotic resistance, we're looking at the bacteria and how resistant that bacteria is to the antibiotic that it's being treated with. Okay, so it has nothing to do with our own resistance or the drug's resistance to us as a patient. It's how the bacteria, the target, the pathogen, becomes resistant to the drugs we try to kill it with. Okay, and this can happen easily from bacteria. You can imagine a population of bacteria being targeted by an antibiotic. That antibiotic will kill most of the bacteria on that petri dish or in an infection, but some are going to have genes that allow them to survive. Those surviving bacteria will then pass on the genes for survivability against that particular bacteria, and before you know it, we can have an entire population of resistant bacteria. And this is becoming a huge problem in our healthcare settings. So it's important to think about how resistant bacteria are when we're treating them, and perform sometimes, especially in microbiology laboratories, susceptibility testing on specific bacteria from an infection. And to test a bacteria's susceptibility to antimicrobial drugs, a common test used is the Kirby-Bauer test. And that's one that we're going to be doing in lab. And this type of test can look at how susceptible a bacteria is, and based on a spectrum. All right. Pretty inexpensive to do and can test a variety of drugs. So this involves spreading test bacterium on the surface of an agar petri dish. Okay, this has been treated, this agar treated or infused with certain nutrients for bacteria to grow. Okay, we're not trying to limit any bacterial growth on the agar itself. So we get bacteria spread on the petri dish, and then we place on the petri dish, discs. These are usually little paper punch-out discs, kind of like a hole punch, but they're infused with a set amount of a specific antibiotic. We put those on the agar surface and incubate the plates to see if the bacteria can grow over those antibiotic discs, or if there's a zone of inhibition that forms. If the zone forms, we measure the diameter. Okay, and this is what it looks like. I apologize for some of this wording. Here's a petri dish, and we have a lawn of bacteria growing on it. But around some of these white discs, we can see a clear ring. It's kind of darker here because the background is dark. That's the zone of inhibition. Okay, and that tells us that the bacteria cannot grow where that antibiotic is present. When you see a zone, it means that that's effective. That antibiotic is effective. When there's no zone of inhibition and the bacteria grows right up and over the discs, that means that the bacteria is resistant to that antibiotic. So on this petri dish shown in the picture, we have several different antibiotics being tested. Some are effective against the bacteria, and some are not effective. This is an urgent matter, looking at microbes and how resistant they are. And the CDC is compiling a list of top drug-resistant pathogens in the US, ranking them urgent, serious, and concerning. And more species are being put on those lists. So I hope this prepares you for the lab a little bit and gets you started into chapter 15.